Ernesto here has allowed us to document this on video. Ernesto here has a little bit of a hearing problem, so I'm going to talk a little bit louder. He's got his hearing aids in, but he had a stroke back in 2003, and since then, this is the worst case of vertigo I have ever seen. He has vertigo on both sides when he turns his head to both sides, but it's been constant. Am I right?
Yes.
You could come into the picture here. He's had it constant since 2003?
Yes.
So could you imagine the room spinning every day of your life for 17 years, okay? I don't know about you, but I've had vertigo. That would drive me crazy. So I really want to help him. He saw one of our other videos about a young lady with seizures that had vertigo cleared up. So we're going to do a mixture of things here for him today. The first thing we do is a class 1A laser therapy, and this is really important. The laser therapy, we're going to hit certain points for him, and these points are going to hit certain areas and certain nerves. I won't get into the specifics because I don't want to confuse everybody, but we're going to have you look straight forward. And we've also taught him how to do the Epley maneuver at home, right?
Yes.
So we're, 2 treatments in?
2 treatments,
So
one in the morning and one in the evening.
Okay, so we've seen him, this is our 3rd visit, and he already now, he has dizziness every day, but he can control it now. So we've given him, there's another video we have called the Epley Maneuver at home. So it's a maneuver that you can do yourself at home if you suffer from vertigo, dizziness. So he's been able to control his vertigo with the Epley Maneuver at home. So that's really great news, but we have a long way to go with this case. And we want him to be able to walk without a cane, without assistance. Right now, you have to help him. She has to help him even go to the bathroom, get up and go to the bathroom. So you can imagine it's debilitating, and I can't wait to help him take control of his life back again. So we're doing the cold laser in specific spots here, and then we're actually going to take his hearing aids out, and we're going to go in with a probe, and we're going to go inside the ear. And then after that, we're going to do upper cervical specific work on the top of his neck. You can feel his atlas bone, the very top bone in the neck, which carries blood supply to the head and brain. You can feel it. It's completely shifted to the left side. But he had a stroke, so we can't just go in there and crack him and, as they call it on some of these YouTube channels, the ring dinger. I'm not sure what that is, but you can't just send him to any chiropractor and have him adjusted and cracked that way. There has to be a specific technique done for him because he's a high risk, because he's had a stroke. He's had a couple of strokes actually, right?
Yeah, many strokes.
So we'll show you the chiropractic adjustment in a minute, and then I'm gonna have him take his hearing aid out. So we just put this probe on, and we're able to focus all the light into this tiny little tip right in through his ear. Let me know if you have any pain, okay?
Yeah, okay.
And this is where I wear it. Could you hand me those? And if you could, don't look at the light here.
Isa.
And we're gonna give him a pair.
Gatitinin masyado.
Okay. We do this for about a minute or 2 of this ear. We're going to do the other ear as well. We're going to do a few other points. And I'll show you exactly where those points are. The next point is right here behind the mastoid. Okay? And then we're going to go ahead again, another minute in front of the mastoid right there. But we're going to go back in the ear. And then I'll show you in a few minutes how we adjust the upper cervical spine, and then also we're going to do the Epley maneuver with him today. Okay, so with Ernesto here, we're going to do the Epley maneuver. This you can do at home, And we're gonna do it for the left side. And this so far, this is our third treatment, and he's been able to control his vertigo. Not completely, but he's definitely gotten some relief from this maneuver, correct?
Correct.
Okay, all right, so you're gonna bring your head back, and then you're gonna look up to the left. There we go. We're gonna bring you back very quickly, and we like to put a pillow here that goes under his upper back so the head is tilted back and to the left. You wanna make sure that head is tilted back and to the left when you do this, okay? Ready? 1, 2, 3, and back. Okay. Do you have any dizziness, Ernesto?
No.
Okay, so we've actually, before we just shot this video, we did the Epley Maneuver once already, right before this. And he's already doing better. Any dizziness?
No.
Okay.
Nothing.
Okay, normally when they have the dizziness, you're gonna let that dizziness subside. It may take 30 seconds, it may take a minute to go away. And then we're gonna go ahead and turn him over on his side, all while he's gonna be looking at a 45-degree angle to the left. So we're gonna go ahead and turn you over on your side now. Okay, go ahead, and I got you here. I'm not gonna let you fall over,
No, I'm
okay?
busy now.
You're dizzy now? Okay, so let's just hold it there. Let's hold it there for 30 seconds to 60, and let me know when that subsides.
Okay.
You're doing better now?
Yeah.
Okay, now we're gonna turn you over onto your side. I got you from behind, okay? Yep, and there he goes. So he knows how to do this. He's got it down pat, and you see his head is facing at a 45-degree angle down. Do you have any dizziness?
Okay, nothing.
Nothing? No dizziness?
No.
Okay, so like I said, we want to wait a few seconds. Sometimes it takes 2-3 seconds for the dizziness to go away. Sometimes it takes 30 to 60 seconds for it to go away, and in severe cases even longer sometimes. But on average, 30 to 60 seconds. Now we're going to slowly sit him up, and when we do, we want to keep his head turned at a 45-degree angle. So go ahead and push off this elbow and this hand and swing your legs down. By the way, this is the right way you should get up if you have a bad back. There we go. Good. Any dizziness?
Yeah, I'm dizzy.
Okay. Let me know when the dizziness subsides, when it goes away, okay?
Okay.
And where's his collar?
Okay, lighter and lighter. It's lighter.
Okay, now you're gonna go ahead, well, let me know when it completely goes away, okay?
Okay.
You wanna make sure it's gone completely. You don't want it just to be lighter. It should completely go away, and the room should stop spinning completely, okay?
Right now.
Okay, now it's completely better. It's gone.
Yeah, it's
The room
better.
is not spinning?
No, not yet.
Okay, now we're gonna slowly turn to center to look at your wife. Good. Okay, any dizziness there?
Look at me.
None.
None? Great.
None.
Now we're gonna collar him up because we don't want him looking down, so it's a really good idea to put a neck collar on for about 2 to 3 hours after you do this. Now we're gonna have you slowly get up, and we're gonna have you sit down here, and we're probably gonna have to do it again. So as you can see here, he needs help just to walk. And let's let him go on his
But
own
he
here.
can stand
See, this
now.
is a change. This
And
is
keep
better.
walking.
He could barely even do that before. So we're gonna check in again in about 2 minutes, and we're probably gonna do the Epley maneuver again, and then we're gonna adjust him still. We haven't done that yet, so. Okay, now we're gonna do an upper cervical adjustment. So I'm gonna have you turn over
Not seeing him.
in just a minute here. Just relax yourself here, okay?
Yeah.
Turn over on your back. Okay. Okay, so Ernesto cannot just have any regular type of chiropractic adjustment. He's had a few strokes. So you have to be very careful adjusting him, and he has a severe case of vertigo, and the atlas bone, which is the top vertebra in the neck, surrounds the brain stem, and there is a vessel, blood vessel, that goes through it and carries blood supply to the head and brain. So if there is a misalignment in that top vertebra, C1, atlas vertebra, it's called the atlas, or C1, if that vertebra is out of place, it can torque or pinch that blood vessel, creating a lower blood supply to the head and brain, and therefore less oxygen, and can also cause dizziness. So when you're treating a patient with vertigo or dizziness, you have to check the upper cervical spine. And clearly, you're sensitive right there. Are you painful? Is it painful there, Ernesto?
Yeah, it hurt.
Hurts. Okay.
It hurt from that
So first, we're just going to do some trigger point therapy right above the atlas in the suboccipital region. A lot of times, people that have vertigo can also have a lot of neck stiffness, neck pain, and his posture, you can see his head is kind of tilted to one side and one shoulder is higher than the other. So we're going to work on fixing that. And as I said before, we did cold laser therapy for the vertigo. We did the Epley Maneuver a few times, which improved his vertigo a little bit. And now last but not least, we're going to do a chiropractic adjustment. We're going to do an adjustment called a toggle recoil, okay?
I think you're a lot different now.
Okay. Do you have any dizziness right now?
Just a little bit.
A little bit?
Yeah.
Okay. Okay, I'm going to have you lay on this side. So, yep. Okay, this is the upper cervical adjustment that we're going to do. Okay. And I'm going to have you slide down a little bit. Now, not all chiropractors are trained in this technique. Slide down a little bit more. The school where I went to actually focused on this technique, whether you liked it or not, whether this was a technique you were going to practice or not. And now you're good right there, Ernesto. Perfect. And now I can appreciate that because this is a very specific technique used for specific conditions. It's not something I use on all patients with neck pain, but it is on all patients with past history of stroke and or vertigo. So this table here is going to drop down like that. How you doing here, okay?
Yeah, okay.
Okay, lay on your back. Do you have any dizziness right now?
Oh,
No?
no.
No. This is probably one of the first times he hasn't had dizziness in years.
Good,
So that's why he's laughing.
He's laughing.
We're going to get him there. I am determined to help this man gain his life back. Okay, now I'm going to have you roll over onto your side. I'm going to show you guys the right way to get up. If you have a bad back, if you're on the couch, your bed, do not come straight up like this. Okay, I'm going to show you the right way to get up. The right way to get up is to turn over to your side. and to push off of his hand and the elbow, and then also at the same time
Yeah,
swing your
still
legs
in
down.
the-
So you're
in
using the
the
momentum
doctor,
of your
with the
legs,
doctor.
and you're gonna push it off.
Not
There you
ready
go.
yet.
And that's the right way to get up.